talk to an expert around the world about things coronavirus, about things pandemic, and about things related to your health, hopefully giving you information you can use for you, your family, your loved ones, your community to get through this pandemic sooner rather than later, with the goal being keeping everybody as safe and as healthy as possible and getting them that information that they need. And today, we're going to talk about children and the concerns with children right now with the pandemic. To help me do that, wonderful to have with me Dr. Fatma Levent. She is a board-certified pediatric infectious disease specialist. She was an assistant professor at Texas Tech Health Center. She is now at the Orlando, Florida at AdventHealth there as an infectious disease doctor. Fatma, thank you for being here with us.
Thank you for having me.
You know, and it's a lot of news right now. And yesterday, the big news was the, obviously the ACEP meeting, the CDC's advisory meeting. We'll talk about that in a little bit. But there's a lot of confusion out there about pediatric hospitalizations, children's hospitalizations. And a lot of the concerns focuses on a couple of things. One, of children coming to the hospital because of COVID, and children coming to the hospital and then subsequently finding out they have COVID. What does all this mean, and where do we stand with all this?
Sure. Actually, recently we have seen an increase in the pediatric hospitalizations. I was on call, as I mentioned to you earlier, these last 2 weekends during the holidays. And it was fine until this past weekend, and it just picked up quite a bit. I'm assuming as everybody's coming back home from, getting together. So the infection is probably going rampant in the communities. So we are seeing increased number of hospitalizations from pediatric perspective. The good news is we are not seeing as much in the ICUs. It's usually pediatric floors that are being occupied by our, pediatric patients. It is a little bit less severe than the last variant, the Delta variant. However, it is still so common that I think we're seeing that complicated patients, especially with chronic diseases, come into the hospital with this infection.
Now, are some of the children, because I've heard from many experts saying they're not seeing as many in the ICU, they're not seeing as many on respiratory support, but are some of them getting in that type of trouble?
Yes, they are. The numbers are much less than the last variant, maybe like 1/3 of it. However, some of them are really sick and some of them definitely need extra support.
And then let's break it down into age groups. Let's start with the 5 and above, because those are the ones that can get vaccinated and can get booster shots as well now, 12 and above. Are you seeing a difference in vaccinated versus unvaccinated in those age groups?
Definitely. I haven't really seen any vaccinated kids that are in the hospital. So most of them are unvaccinated.
Interesting. And so the unvaccinated, you said you haven't seen many. Have you seen a few that were vaccinated, and do they tend to have lesser symptoms, less severe symptoms?
If they have chronic issues or immunodeficiency, they tend to respond a little bit less to the vaccine. So I personally haven't seen any very sick patients who are vaccinated, but I'm assuming we're going to see some in the future because our numbers are increasing in the community who are being vaccinated, but mostly they are chronic patients or immunodeficient patients.
Now, how about that other age group, the 0 to 5, that cannot get the vaccines yet? What are you seeing in that group?
We are definitely seeing a little bit increased number on those too, because they can't really be protected, unfortunately, and they're more likely to have more issues. However, again, it's a little bit less definitely than the Delta variant, which is hopeful, but the number of infections in the community is so high that unfortunately, we're expecting an increase even in the next couple of weeks.
And with parents of that age group, the 0 to 5, what are you hearing from the parents?
I'm hearing a lot of concern from the parents. We're getting a lot of questions from the community about what do we do? How can we protect them? Is there anything we can do? So there are some things we can do, but it's really very minimal. Again, it's really hard to, put any masks on them, and it's really hard to do the social distancing on them. It's a little bit harder. So what I'm recommending to the parents is to try to create an environment where everybody else is vaccinated around them and they're using their social distancing, masking, so they can be protected.
And that was my next question. When it comes to the 0 to 5-year-olds, one of the things I always say is the best way to protect them, since they cannot get vaccinated, is to circle them with people that are vaccinated. And are you seeing any difference in the patients you're seeing in the hospital with the parents being vaccinated or unvaccinated, or siblings being vaccinated or unvaccinated?
Yes, definitely. We're seeing a big difference with that. Most of the patients who are in the hospital have their parents or their, loved ones in the hospital at the same time too. Sometimes, it's just, goes rampant in the community. And the ones who have parents that are vaccinated, they're usually milder disease, or they're a little bit less exposed too. So it is really important to cocoon that family and try to do whatever we can to protect the ones that cannot get vaccinated or that has chronic issues as well as immunodeficiencies.
One of the things we've been hearing about is with children, especially that are young, is that with Omicron, we know that the symptoms tend to be less, and we keep hearing the less severe part, but still, with little ones, their airways are so small and still not mature. We're hearing that Croup or Croup-like symptoms are one of the things that is popping up with children in this age group when they get COVID. Are you seeing that as well?
We are seeing similar symptoms to any other colds, which, one of them is the croup. As you mentioned, their smaller airways get swollen and they can have croup-like symptoms. And you brought up a very good point. We're also seeing some other viruses that are in the community. So it is very similar to those viruses. Sometimes it's really hard to say which virus is causing it. And sometimes we see two viruses together. And as we go into the flu season, we're definitely expecting maybe some patients having flu and COVID together. So it's really going to be complicated with that. So whatever we can do to protect them from getting COVID and other infections will be great.
Are you seeing any children with both infections, cold and flu?
Not yet. But, I feel like we see other viruses together all the time. So I'm expecting as we have more COVID infections, we're going to have dual and sometimes even triple infections at the same time.
Have you seen any kids, regardless of age, with just the flu? Have they been hospitalized yet?
Yes, we have started seeing it. Yes, sir.
Interesting. Okay. Now, when it comes to these croup-like symptoms that we're seeing in these children, is it treated the same way that humidified cold air and possibly medications, steroids?
So most likely, we do symptomatic therapy for a lot of these infections. There are some more things that we can do as they get into the hospital. Steroids is one part of it. And there are some antivirals that we use only on severe cases.
Yesterday we talked about the ACEP, the Advisory Committee on Immunization Practices, the CDC's Advisory Committee, following up to review the information from the FDA, who gave the emergency use authorization for 12 to 15-year-olds to get the booster shots, and they recommended that. And so Dr. Walensky followed suit and recommended it and now put it in the should be boosted category. One of the interesting things that came up, one of the slides, which I had, to be honest, hadn't really thought about, is the vaccine protecting against MIS-C. That's a multi-system inflammatory syndrome in children. And they said it was 90% effective at preventing MIS-C. I had never really thought the vaccine would be able to help in that category. It didn't even enter my mind, but it sounds like another good reason to get the vaccine for children.
That's absolutely true. So actually, that's one of the reasons I always tell the parents. I know we don't necessarily hear about MIS-C, which is the multi-system inflammatory syndrome in children that happens usually 3 to 4 weeks after the initial infection. And most of our MIS-C cases have had very mild or not even, symptomatic disease initially. And unfortunately, it comes back as a very, ill patient to the hospital, and they may or may not have any background with any other problems or chronic diseases. So it is definitely a protective thing to do for these kind of, all of the population, to vaccinate them. Because, when people think about COVID, they're thinking about asymptomatic or mild symptoms like a cold symptoms, but it can cause more things. And not only MIS-C, we are seeing also the long COVID, as it's well known in the community, that it is mostly seen with adults, but we're also seeing it in the younger kids too. And vaccination also protects against that too.
And just so people understand the bottom line here, essentially, because you're a pediatric infectious disease doc, so you have the word here. even though we're hearing again, and we've talked about this, we're hearing that Omicron is less severe and doesn't affect children as much, it still can cause some issues. They still need to be protected against it.
Yes. And that's one message I want everyone to get out of this. Even if it's less severe, it is so transmissible. It infects so many people, including kids, that, somebody is going to get really sick with it. And some of the kids that are totally normal with no other problems may get very sick initially or even later from the infection. So definitely, I highly recommend that everybody gets the vaccination as they get it available for their age group.
I want to switch topics a little bit, because right now the other big topic are kids returning to school. And with kids returning to school, it's been a mosaic across the country of some schools, as in Chicago, shutting down, other schools, as in New York City, say we're going ahead, we're going to incorporate testing and masking. How important is it for kids to get to school and to have that testing in place?
That's actually a great question. As a physician and also as a mom, this is also affecting me as well. I have 3 adolescents going to school, and I've seen them when they were trying to do online teaching. It was really hard for them. So we need to probably do everything, if possible, to get them to school in a safe and healthy way. So I highly recommend then we, continue masking, social distancing and, hand hygiene, but also vaccinations, I feel like is going to keep them in schools as well. Not only the kids, but also the staff and the teachers. If we can, again, create an environment where everybody is preventing their infections or decreasing the number of infections, I think we can continue to get them to schools.
Testing has been a big issue and a big concern with schools and children returning to schools. Do testing programs work to keep kids in school, keep them safe?
I think it's one part of it. It's not by itself is important, but I feel like we have to incorporate it into the whole big picture. But I feel like masking is going to help quite a bit, and definitely all of the other measures that we have talked about. So sometimes, we don't have none of these things are 100%, including the vaccines. So I feel like we should do whatever we can to do all of them together and look at the big picture. And there are going to be some cases, even if we do everything right, and that's when we are available for all of the things that we can do in the hospitals. But if we can try to keep everyone healthy and home, that would be excellent.
And when it comes to testing, there's a variety of different ways to use testing. And some have advocated using it in random, kind of a random survey throughout the day. Every child gets tested, which is a bit unrealistic because that's going to be a big outlay in tests. And others have said, well, okay, if we have pods and one person in a pod gets sick, we can test everybody else. What do you think works best in the testing arena? Or is it depending on where you are and what your resources are?
I think definitely it depends on where you are in the resources, because depending on your resources, you don't want to use it on people that don't necessarily need it. So definitely exposure is one of the big things that we're using the testing, or going back to work, going back to school. So I feel like it is a very important part of making sure that everybody's protected, but by itself is not enough. So we need to incorporate it into the big picture.
It was interesting in the ASAP meeting yesterday, listening to it, when it came to the public commentary part, one of the comments that came up is the fact that the doctor was getting a lot of questions from patients about the long-term effects of the vaccines in children. And they actually showed a chart on hesitancy for vaccinations, and that was the number one reason parents were hesitant. Should they be concerned about these long-term side effects?
And I totally understand everybody's concern, because these are new vaccines and, we haven't had it for too long, but I can actually reassure them all over the world, millions of people, millions of kids have gotten these vaccines, and we're really not seeing much of serious problems. And one of the things that goes back to what the natural infection does to you. So I feel like we definitely talk about the side effects and outcomes of the vaccines, but we don't talk much about what the outcomes of the natural infection is. The natural infection causes a lot more problems than the vaccines. Of course, we do see very common things, little fevers, arm pain, soreness, and not feeling well for about 1 or 2 days, but it's much better than, having really bad outcomes, including death, unfortunately.
I know one of the side effects that parents get worried about is that myocarditis, especially in the older children. And it was interesting looking at the CDC site. They looked at 12 to 15-year-olds myocarditis. 18 million doses had been given. There were only 265 cases of myocarditis. So that's extremely, extremely rare. No confirmed deaths in this category. The vast majority have recovered. And in Israel, 41,000 doses were given to children in this younger age group. And they ended up only having 2 cases of myocarditis. So again, it's showing you that these are rare. And like you said, the risk of COVID, we know there's an associated risk there. We know it's a high risk when patients get COVID, and it could be a long-term risk.
Yes, definitely. You touched a very important point there. I feel like, people hear about myocarditis and they first think about the vaccine causing myocarditis. But unfortunately, COVID causes myocarditis a lot more. And this is, when you are vaccinated, you teach your immune system to respond when you get exposed to COVID. And COVID is everywhere. So you're probably going to get exposed, especially with the Omicron being so transmissible. Your body's going to see it. And for those kids that we love and we want to protect, this is one of the best ways to protect them because your immune system is ready when the actual infection comes. And for myocarditis cases, we have seen a couple of those in our hospitals. They do really well. The outcomes are great. However, I can tell you that the myocarditis from the actual infection or the MISC is much more severe, and they stay in the hospital a lot longer.
And like you said, you being a parent yourself, myself being a parent, my kids are adults, but when they were children, I want to know everything before they got a shot. I want to know all the details. What are the biggest questions you're getting from parents right now?
About the vaccine?
About the vaccines, about COVID, about the pandemic. What are the biggest questions you're getting from parents?
I think the biggest question is, how can we protect our children with the safest way? So I totally understand. I'm in the same boat. They just want to make sure that they're doing the right thing. So we're just always recommending what I'm doing to my kids is to protect them, all the things we have discussed, including vaccines. We're just trying to do our best to do that. And then the other thing that comes to my attention is misinformation. So there are so many information out there on social media, internet, and I feel like there are some trust issues with the information out there. So I feel like I encourage people to go to the trustable resources that they can find. The best place probably is someone you already trust, your pediatrician, your doctors, your family members who are knowledgeable about this, media people who are knowledgeable, and of course the CDC and the AAP, all those recommendations from people who are doing this research, I feel is really, really important. But I feel like if they have a trustable resource, especially a person they can talk to, that is really important.
One of the things we talk about are these N95, KN95 masks being the best protective, and not to use cloth masks if you can use one of these. But one of the things I always mention is that for children, face sizes might not fit. They might not wear them all day. And the best mask, as we say, is the mask you wear. What do you tell your parents as far as children, what masks to use?
I think I would do exactly what you said right now. So whatever mask that fits them, that they want to put on their face. Of course, cloth masks are a little bit less effective than the surgical mask or the N95s. But I agree, it's really hard for a child to put the N95 on them. The N95 that you were putting on your right hand was a little bit, easier to put on your face, that one. However, I feel like any mask, any barrier is going to be the best that they can use, and continue to put it together with hand hygiene as well as social distancing.
Great. This has been a wonderful conversation. I always like to end with a message to people. So what would you tell parents in particular who are hesitant about getting the vaccination or their booster shots for their children? What message would you give them?
I would say I was waiting for the boosters for my 15-year-old. I'm very excited to give it to him. And then a 16-year-old who got his boosters. I would say as a parent, the best thing you can do for your children is to protect them. And the best way to protect them is giving vaccines and using all of the other measures we have talked about including hand hygiene, social distancing, and masking. We should just do the best to protect our children as well as ourselves.
And I know we're all tired of the pandemic. We're all tired of having to do the social distancing, wearing masks, all those things. But
right.
I think you would agree, we are going to get there. We just need to get there together.
I agree. We can't do it by ourselves. And that's why we're just trying to reach out to everyone and try to, create resources that are trustable. And I can't do it by myself. You can't do it by yourself. We have to do it as a community. And I always say, to reach the community immunity, we have to do our best to just get there. But we are going to get it. I'm very hopeful, and I'm very hopeful that this new virus is kind of evolving into being a cold-like virus. It's a little bit better than the previous variants, but I bet that we're going to have many more variants to come. So that's why we have to be careful, and we have to take it very seriously.
Fatma, I couldn't agree more. Thank you for being here, and thank you for being one of those experts that we can rely on to get the excellent information, especially for our children. And again, Dr. Fatma Levent with the Medical Director of Pediatric Infectious Disease at AdventHealth for Children in Orlando, Florida. Thank you for your time. Thank you for all that you've been doing this last year and a half, and thank you for helping keeping us safe.
Thank you so much for this nice conversation. I appreciate you, John. Thanks.
You bet.